tax. Daphne Shimizu will catch up on the All Rise and a little bit on the advanced child tax credit. Dr. Ann Pobutsky, data. She's got all kinds of information about who's spreading the COVID, who's getting the COVID during this surge here. It's Friday, September 10th. Let's go ahead and head into the Zoom room with our hospital update for this morning. We have Hospital Administrator Lillian Posadas. Good morning, Lillian.
Good morning. Buenas, Guam.
Let's go ahead and get right into it.
Happy Friday.
Happy Friday. Well, hopefully it turns out better. But what is our COVID census right now at the...
We're still blessed.
Right,
Yeah.
GMH.
We have 40 individuals in the house with the COVID diagnosis. 3 of them are in the ICU level of care. Of the 3, 1 is on a ventilator support. We have 1 individual in the progressive care unit, which is the level between telemetry and ICU. 20 of these COVID individuals still require cardiac monitoring, which is the telemetry unit. 14 of them are in the regular medical surgical unit, and we have 2 female individuals in the postpartum OB ward. So we have 40, total of 40. Of these 40 individuals, 22 of them are unvaccinated. In the ICU, of the 3, 1 of them is unvaccinated, and that is the individual on ventilator support. So, you know, as you can see again, the numbers are showing in terms of being unvaccinated and the acuity and severity of the illness if you're unvaccinated. So I'm just highlighting that point. You know, please, again, get vaccinated so that we can hopefully minimize the acuity and severity of your condition if you do get the COVID infection.
What are we seeing?
That's where we are.
What are we seeing at the ER level?
We are seeing also children, pediatric cases. We are seeing, you know, a combination of vaccinated and unvaccinated individuals. Depending on their condition, they can be released. They are released home. Or depending on their oxygen level, they get admitted. So, you know, it's a mixture. It's ongoing.
Did you say 3 in the ICU were vaccinated?
What was that? I didn't hear your question, Bree.
3 in the ICU. Did you say they were vaccinated patients?
1 of them is not vaccinated. The other 2 are vaccinated.
Okay.
And the one who is not vaccinated is on the ventilator support.
Right. Lillian, was GMH the recording party for the 155th death that was reported yesterday?
That was the 54-year-old individual, correct?
Yes.
Right. That was here at GMH. I don't remember the details because that was on September 8th. So it was on Wednesday that was reported. I don't remember the details other than the individual was 54 years old.
I think 54 years old, multiple underlying comorbidities, and fully vaccinated.
Okay, I need to go back and make sure that is to confirm that.
Yeah. Well, I
Has
think
there
it was in
been
the
any-
JIC.
Yeah,
right?
it was.
in the
Has
JIC.
there been any
It was in
other
the JIC. Yeah.
COVID-related fatalities?
What was the question?
Oh, have there been any other COVID-related fatalities other than the one that was reported regarding the 54-year-old man?
I don't have any report as of this morning of any COVID-related death. I was out yesterday, so let me go back into my reports from the nursing supervisor if there was any recent one that the JIC hasn't been able to put out yet. Because sometimes it gets delayed, just confirming and making sure that, you know, the families are notified, public health is notified, and that's why sometimes the report out of JIC gets delayed. So let me backtrack on it, and then I'm using my phone, and that's where I get all my information.
Right.
And I don't want to lose the connection talking to you all.
Yeah.
So, you know, I can text it to you if that's okay with you.
Yeah.
Any update on RegenCove?
We're waiting for a supply. We requested, as what Mr. Kando reported yesterday, 600 doses. The shipment hasn't arrived. We don't know when it will arrive. So right now we don't have any RegenCove. We do have the dual monoclonal antibodies, which is the bamlanivimab and the etesevimab. That's the combination. And so we have that in place. We're just waiting now for the clinicians to approve the protocol. And so I believe that because I signed off on the protocol, so I'm trying to find out where it's at right now as of yesterday. But I know I signed the protocol.
Lillian, can you confirm if that the monoclonal antibody treatment we have is that the one that's less less effective against the variants?
The which one was that again?
The antibody treatments that we have, are those the ones that are less effective against the variants? Because I know they said that Regenco it worked against like the Delta and.
Correct. But remember the bamlanivimab was taken off. It was put on pause when it was being administered by itself. Now it's combined. It's a bamlanivimab and etesivimab. And so the combination of those two monoclonal antibodies have been more effective. But by itself, bamlanivimab has not been effective since the Delta variant came, started. So that's why they put a pause on the bamlanivimab.
How are we doing with the staff? Have we had any infections, COVID infections with the staff, Lillian?
Yes, unfortunately we have. For the month of August alone, we had like about 16 of our staff with COVID positive results. This week, just this week alone, we've had like about 7 of our staff with COVID infection. A variety of the areas, the departments, dietary, laboratory, security, and I think radiology. So, it's just, it's happening. The
Lillian,
exposure is happening.
Yeah, so how does that affect your staffing levels?
Well, it affects our staffing, especially if, the employees, when we discover it, that they were here at work. And so the exposure, so our infection control and employee health team, they right away start the contact tracing. And so we quarantine those who have had close exposure to the staff if they were on duty. And fortunately, some of them were off duty. And so the minimum, the exposure amongst the team, of coworkers is minimal. But still, there are some that were at work when we discovered that they converted to a COVID positive test results.
Lillian, just to go back to confirm, you said 16 infections in the month of August. And did you say 8 this week?
7 this week. 7 this week. Oh, so, maybe either 7 or 8, one of those.
That's a pretty, wow. That's 16
yeah,
plus.
for 1 week. Absolutely.
Well, I mean, just tracking from August, and we're only in the second week of September. So that means that you've had nearly 25 staff infections.
Right, correct.
How many?
It's concerning.
How many of them caught COVID at work? From exposure at work?
I don't have the exact number. One of them was, you know how some patients need close monitoring, and we call them sitters and watchers. And so one of them was sitting and watching one of the patients up at the SNF. And so that's where the contact was.
Wait a minute. I'm sorry, SNF? I thought SNF was COVID-free.
Yes, it is COVID-free. It's supposed to be COVID-free, but when it does happen, that patient gets transferred over. So we try and keep it as COVID-free, but we are monitoring patients and staff twice a week. And so when the results come back, that's when we move them over. So unfortunately, that's what happened with that one patient that was exposed to one staff who was exposed to a patient who converted.
Do you guys do your own contact tracing?
Our infection control nurse and our employee health team, we do the contact tracing amongst our staff, yes.
So 7 this week.
7 or 8.
Right, 7 or 8. So they're isolated. What does that mean? How many are staff are on quarantine then?
I don't have the exact number because it depends on the exposure of the staff, if they were here on duty or that they were off. If they were off for several days, then that means there was no exposure in the hospital.
Well,
So is it presenting a problem, Lillian, with the amount of staff that you have on hand, given that you've got positives and, you know, assumedly
we have others.
Close contacts quarantine?
Right, but we also have staff who are willing and who are committed to then continue working. They're working extra hours. So, you know, everybody's stepping up to the plate and stepping up to their, responsibility to help out and you know, put in extra hours to cover where we need them to cover.
Well, our prayers are definitely with the hospital staff, Lillian. That's pretty alarming, and
it is. And but you know, we have to continue the fight.
Yeah.
We have to stay the course.
The risks, right? Sorry, I did want to go back to SNF. Now that you mentioned there was that one patient that was positive, and you had the sitter or the worker sitting watching that patient also positive. Have you had to do anything, change anything at SNF? I mean, you know, because we all know that this is really contagious. Any other patients or any other workers exposed?
And that's why we're testing them twice a week. Not just weekly, but now twice a week. We're testing everybody. All patients, all staff, and whoever else enters the facility.
When did that happen?
It's twice a week is what we've increased our testing and monitoring, and again, the contact tracing. We removed that patient immediately, brought the patient over to the acute side, and we continue to monitor twice a week with the testing.
When did that happen?
It was this week. That one employee who was serving, providing the sitting and watching that needed on that one patient. And so when it happened this week, we immediately brought the patient over to the acute site and put the patient off duty on isolation at home and the contact tracing.
I'm sorry, can you, with the 16 staff, 7 this week who were infected with COVID, do you have the vaccination status of them?
No, I don't, but some are vaccinated, some are not vaccinated. But majority of the staff were vaccinated is what I recall, but I'll have to go back to the listing to confirm all that.
I'm really lost here.
Yeah. Was there, did you have a meeting, Lillian, maybe just like because I know we're all a little rusty with our COVID, but did you have a meeting with the staff, say, hey guys, let's tighten it up, you know?
When we had the town hall meeting, I think it was last month, we had in August a town hall meeting. We again sent out the message to encouraging staff to please, get vaccinated. When the executive order came out for mandatory vaccination, we had a surge of employees. I think in one week we had like 36 staff who were still unvaccinated got vaccinated. So that helped, that prompted our staff to get the vaccination. And so on our day briefing, day communication, we continue to, again, encourage staff to please proceed with getting the vaccination. Division heads and department heads in their staff meetings, we encourage them to put that on the agenda to discuss with the staff.
Any of your staff had to be hospitalized?
Had to be what? Hospitalized?
Yeah.
None so far that I recall in the report. None have had to be hospitalized. They are at home on home isolation.
Mm-hmm. Where are you then? Because this is it sounds like it's a pretty big hit to GMH in terms of staffing, right? And I know that when we last spoke with you, you mentioned that you guys were working on the requests, the forms to DOD for the medical assistance. Did that go out already, or did you get a response?
We're gonna finalize that today. In discussing it with the governor said yes, proceed with requesting through DoD, through HHS, and she will facilitate that with the head of HHS, Ms. Bonnie. I forgot the last name, but yes, we're gonna proceed with submitting our completing our form for additional medical staff, particularly nursing. Because of the high number of COVID patients needing telemetry, service of care. And so we're going to need to get that document, the form completed today and submit it to HHS. Because we're not getting much of any from the travel staffing solutions. I guess they're being deployed throughout the U.S. They're given that priority. And so, the travel nurses, I think they rather just stay within their continent, of the U.S. rather than traveling over to Guam.
Okay.
So what's the question?
No.
Just kind of taking it all in, Lillian.
Yeah. Oh, yeah, absolutely. Every day, every moment, we're taking it all in, and we're switching gears all the time, depending on the numbers that come in.
And these numbers
that we have.
These numbers that are coming in, I mean, 215 positives, over 300 the day before. There's
Right.
Unfortunately there's been a lot of times during this pandemic where we've asked you to kind of speak out to the people. Right? We're heading into the weekend here. Obviously, we're in week 6 of this surge, and there just seems to be no respite from these numbers. So, what would your message be to the community out here as we head into this weekend?
Yeah, well, again, continue to follow the protocols of wearing your mask, washing your hands, try to keep the distance, and particularly get the vaccination. If you can, please try and go get the vaccination. I mean, I understand people have their individual freedom and individual rights, but as I said, it's really more for the greater good. And as Pope Francis said, vaccination is for the greater good of our world, of our island community. So I encourage everyone again to try and get the vaccination.
Oh, dang, you brought the
Thank
Pope
you.
into it.
What was that?
You brought the Pope into it.
Well, hey, that's his message. That's his message. That, you get the vaccination because it's for the greater good.
Right on, Lillian.
Thanks,
Hang in there, all
Lillian.
right? Good to see that smile. We're
Yes.
praying for your staff.
Yeah.
Be
Yeah,
safe,
hang in
okay?
there.
Right on.
Thank you. Take
Okay,
care.
that's okay, so how do you want to do this, Sabrina?